He is editor-in-chief of Transcultural Psychiatry and directs the Culture and Mental Health Research Unit at the Department of Psychiatry.
So I wanted to talk briefly about some work that's been going on over the last few years with the support of the Public Health Agency of Canada, trying to move from a focus on risk and protective factors and then on resilience and now toward mental health promotion. And this is coming out of the Innovations program at a Public Health Agency, which has tried to support innovative projects that take evidence-based practices and adapt them in some ways to vulnerable populations with the aim of promoting mental wellness. And so the explicit focus is not necessarily on mental health problems, although there's a constant slippage back and forth. Even though there's concern about wellness, there's a hope that this will, in fact, do things like address the high suicide rates and address problems of substance abuse and school retention and all the other problems that are clustered together and that share important social determinants. As part of that process, we've been involved in developing a cultural adaptation approach. And so I'm going to talk a little bit about the rationale behind that cultural adaptation and relate it to the specific kind of project that we've been doing that's a mental health promotion project. But as I say, we were given the opportunity in conjunction with this mental health promotion project to work with some other innovation projects to develop a toolkit for cultural adaptation. And that's what I'm going to be describing to you today. It's not quite available for public consumption, but will be very shortly. And so this is part of the preface page for that toolkit. I'll be showing you some pages that are from the near final draft of this toolkit and some of the groups involved. And what was involved in that project was to develop guidelines and a toolkit for cultural adaptation and mental health promotion interventions with Aboriginal populations. And it was centered on a literature review and the study of four case studies of Public Health Agency of Canada innovation projects that tried to develop their own protocols and then to sort of learn from those, to extract from those case studies what were the common principles and could that be articulated in a way that would give guidelines and resources for other people hoping to develop such things. These are the four cases. Four programs, four case studies that are in the toolkit as appendices. And the first one is the one that I'll say a little bit more about, which is the one that we've been directly involved with. And the other ones, you can see that they're working in different settings. One is school-based, some are home-based nursing visits, and the one that we're involved with is actually based in rural and remote communities, in Indigenous communities. And so just briefly, to give you one example, I'll tell you about the project that we've been doing, which Dominique Geoffroy, who's here in the audience, I think has been the coordinator of that project. Thank you. There she is in the back. And you can find out more by going to this webpage. I'll just describe it very, very briefly. And this is a project that brings together a variety of academic and community partners. It was responding to the request for proposals from Public Health Agency of Canada, but it took advantage of the fact that Les Whitbeck and his group at the University of Nebraska had already done a cultural adaptation of a Strengthening Families program, an evidence-based program developed originally by SPOTH in the United States, and had developed that for Lakota community in the U.S. And so when this, he and I had talked at some point about trying to do some mental health promotion work together, and when this opportunity arose, we saw that we could sort of retool this proposal to work with other communities, and so we brought together various partners. You can see there some of the people involved, and here's a meeting of some of the people. You notice some familiar faces there, actually. Look at that. I think there's Arlene tucked there in the middle there. And these are the communities across the country who are currently engaged in this program, 14 or so communities across the country. And what they are doing really is they're given this process of forming a community steering committee, of working with this manual or toolkit that is an example of what has been done. In this case, they're working with one that comes from an Anishinaabe community, and with various guidelines and suggestions for how to localize this, to adapt this to their own cultural context. So they're not starting from scratch, which would be really a daunting task for any small community, be way beyond the time and resources that most people have, but nor are they put in a position where they just have to take an off-the-shelf intervention, either a totally generic one or one that is some kind of pan-Indian one, which doesn't really do the job of addressing issues of culture. Because central to all this effort is to take elements that are recognized as useful from mental health promotion point of view across different cultural settings, but to include as central to the development of the program the reinforcement of a sense of cultural knowledge and cultural identity, the kinds of things that we were talking about this morning as having been suppressed and ruptured for people, and that many Indigenous communities clearly identify as a kind of wound and loss and problem that has to be redressed. So a key part of these intervention programs, even though they include things like mental health literacy and recognizing suicide vulnerability and dealing with conflict and improving family communications, many of which issues can be framed in fairly general ways that would work across many contexts. A big part of all the sessions and all the program is transmitting relevant cultural knowledge that is local knowledge, and so it depends very much on that community and finding a way to build that into the community. And so I'm not keeping up with my slides, so I'll just move along through these slides quickly to get to show you. Here's a kind of overview of the sessions in the Anishinaabe version in terms of their basic. On the right-hand side is sort of an English translation of what the content is in some ways of these sessions. And here's a little more description. In each case, there are certain goals for that session, and the community has some directions on how to do this, but they have a lot of latitude in how they decide to accomplish that goal. It may be that there are very particular local protocols or aspects of history and identity that are the ones that they want to emphasize in this process. And the whole program is about 14 sessions in most situations. And again, this gives you more of a description. This is on the website if any of you want to look at this in more detail. And we're in the midst really of this, we're actually in the last year or so of this project, but just beginning to sort of analyze data from this project, so we'll be able to describe some outcomes. But a big part of the research is really implementation research. So a big part of the research is not whether it has a positive outcome on mental health and wellness per se, we're hoping that it does, but very much on what's involved in actually getting something like this going in a community. How does it work? What are some of the dilemmas that people face in the implementation process? So that's what then motivated this attempt to then describe a cultural adaptation process, which, as you know, is commonly recognized as valuable, and many people claim to do it. The usual way it gets done is by sort of changing a few words and plastering, putting some feathers on the thing if it's for First Nations, and that's now a cultural adaptation. But there are many other levels that this can be taken to, from really thinking about what specific goals and concepts are and finding the appropriate translation or interpretation in terms of a local context, to actually even challenging some of the goals, changing some of the goals because they're closer to what the local aspirations are. That would be the most radical kind of transformation. And so in this toolkit, we try to lay out these issues, and using these case studies and using some material distilled from the scientific literature as well as our own survey of projects in Canada to give some guidelines for this process. And so that's what I just want to describe very briefly. I think I'll finish well within my time here because I think it's more important that we have some discussion here. And one of the big challenges in all of this work is the trade-off between maintaining fidelity to the elements that we believe by reason of research or theory or experience are the crucial mechanisms, the crucial processes that help something good to happen. And so that's sort of the problem of fidelity and getting the program to actually fit with the local context, the local values and local perspectives. And so this balance between fidelity and fit is much discussed in the cultural adaptation literature. The biggest chunk of that literature is actually not on mental health promotion per se. A lot of that literature is on psychotherapy adaptations, taking manualized interventions and finding ways to sort of tweak them to make them fit culturally. And that's much easier in a sense, to look at. And in many cases, the process is driven very much from the top down, in the sense that a conscientious researcher or clinician recognizes the need for cultural adaptation and so seeks out the appropriate audience who will be the ultimate consumers of the intervention, and gives them some opportunity to give feedback, and goes through a process of adapting it. One of the key issues in looking at this from a broader Indigenous point of view in Canada has been recognizing that the process of community engagement itself, and the extent to which the community feels in charge of the project and takes control of it, is a crucial structural element of the whole process. It speaks to the issues of power that we've been talking about throughout the day today, and that without that, one can do a lot of sort of cultural enrichment and adaptation of programs, and they may not have the desired outcome from the point of view of mental health promotion, because they may not actually empower people, make people feel that they are engaged in revisioning their own lives, and in taking control of that. So a lot of what we ended up putting into this protocol is not in the standard discussions of cultural adaptation. In fact, I think number 5 here is what most of the standard discussion of cultural adaptation is devoted to, expanding number 5, that is giving you a recipe for how to go through this process of cultural adaptation. And we put much more emphasis on what you could say, in a sense, is the ethics and the politics of doing an adaptation process. How does one engage with the community? How does one establish a process that enables the community to achieve their goals in terms of working with an intervention? I've already mentioned this issue of different levels of adaptation. This is taken from a broader discussion of that. I'm going to skip all these because I think these things are better discussed in the context of the toolkit itself, which will soon be available. And our hope is then to, with this process, to then use the network that's being built with these 14 communities as a way to share the resources, so that the communities that are successful in developing and implementing this kind of intervention will be available as resource people and to share their experience laterally, another positive lateral set of relationships with other communities. And this has a lot of aspects to it that are very appealing. It has the implication that people will be able to take ownership of the thing that they've created, that there will be a certain level of openness and acceptance on the part of other Indigenous communities, because there's this built-in credibility, because other people who are in somewhat similar circumstances have already worked this through and found a way to make it work in their community. And so building that community of practice will be one of the key interventions coming out of this. And I'm looking, I thought that I'd put other slides in here, which was why I was skipping past all these others, because I was looking for the ones that showed you all the nice things I wanted to show you. But I'll just tell you briefly, in terms of some of the interventions that took place in terms of adaptation in the Splotchy Nation in central BC, the occasion of developing this program became an opportunity for them to reinstitute certain traditional ceremonies, naming ceremony and blanket ceremony, that were part of traditional adolescent transitions and that had been fallen by the wayside for 50 years or so. This became an opportunity to say, well, why not incorporate this into the program? And this became immensely meaningful for the participants and for others in the community. They're wonderful photographs. Again, I apologize for having brought up or not put those in this. So those of you who were actually in class yesterday saw them, some of them, and they're on the website. You can see them. But wonderful photographs of people expressing their great feelings, with their wearing their blankets and standing as a group of young people and their parents and elders who took part in the program, having gone through this 14-week process. I should say, just to clarify a little bit, that the intervention itself in our own case involves bringing together the families of young people ages 10 to 12 and for a series of 14 sessions, a couple of hours in duration each. during those sessions, there's time that's spent together as a family with family activities. There's time that's spent with the young people among themselves and the parents among themselves talking about issues that concern them and then coming back together again. So there's a process that is allowing the generations to speak to their own concerns, but especially trying to strengthen the sense of a certain quality of family life. And the idea is to get pre-adolescents who are still somewhat engaged with their families, not totally sort of embedded in their peers, at a time to give them sort of a last experience of good family communication, which hopefully will carry over and buffer them a little bit during the later period when they're being, impacted by very strong peer forces that can lead them into various kinds of trouble. So that's the kind of vision of this program, and we've had a lot of positive response at the level of the communities. However, a lot of challenges which I think raise important issues around policy, around design of services. So the communities that have had the most success with this kind of adaptation process and intervention have had some very strong and talented individuals who've come forward and who've invested in the program and made it a major part of their activity. The communities that have had a lot of trouble carrying this through have not had such sort of local champions, and that happens either because there is no one available or because there is someone, but they have so many other responsibilities and so many other pressures on their time, which is often the case in these small communities of people who have these kinds of skills and talents are, have many things they have to engage with that they can't follow through in a way, and so the thing falters. It's also been hard to implement this in small communities that are going through a lot of disruption, and this is part of the problem that with a program like this, with wellness-oriented programs, is that they work best for people who are already well. And this is my concern as a psychiatrist and as somebody who sees the sort of whole spectrum of what's going on in a community, that many people in communities and public health agencies and so on are very keen on talking about wellness. But the fact is there are many people who are not well, and it's very hard for them to get themselves organized and get engaged in these kinds of activities. So the families that tend to come to these activities and are all keen about it are actually already doing, many of them, pretty well. And then they get a lot out of it and have a great time and they're enthusiastic. And many of the families who've taken part in this program want to do it again and again because they find it's very meaningful social activity and they're learning aspects about their culture that they had not had an opportunity to do before because of the engagement of elders and the structures that are put in place. So our dilemma is how to balance that, which is absolutely worthwhile and certainly something for communities to continue to pursue, with ways to reach out to the most vulnerable and marginalized segments of community who may not come forward, may not feel entirely comfortable with other people and so on because of stigma they've already experienced. And this is a real challenge in any community, and particularly in small communities where sort of everybody knows everything that's going on, and nevertheless there are factions, there are tensions, and so on. So these are kind of unresolved issues. I think if a program like this becomes successful, becomes widely prevalent, it can exist in multiple versions, even in the same community. People can join at different times or different cohorts, and it will in that way reach a larger segment of the population. So I think that's what I'm going to stop here. I'm happy to give you a bit more of it, but it'll be available. Some of it's already, some of the contextual information I'm giving you is already available on the website. You can find out more about it. There's a blog where people are talking about some of their experiences, which is one part of the process of this implementation. This toolkit should be available very soon, and then ultimately there'll be publications specifically from this program, which will include the manuals, the training manuals, all these things, which are being presented then not totally as finished products, although there will be finished versions. You can see how nice it looks if you want to sort of do a polished version of your own, but the real point will be that you can take one of these and you can localize it. You can say, these are the parts I want to keep. This part, we have to find a different concept for this because this is not how we talk about wellness or strength or whatever. We have another language for that, and people will be encouraged to do that so that, and you don't have to do the whole thing, as I say, because it'd be daunting to have to produce the whole thing, but you can pick a component of it and say, well, let's make this very specific to our culture, and we can use some of the other parts because it's close enough. The interesting part of this project is that we have quite a variety of First Nations, some of which are quite close. The Swampy Cree, there are many similarities with the Anishinaabe cultures and even aspects of language that are not very different, but with Splatchin and with other groups we have great difference. So we have a chance to see what parts move very easily across quite different cultural groups and what parts require a lot of rethinking. So thank you very much, and I will stop here.